Oh my goodness, I'm so excited to be hosting Open Door Philanthropy today. Don't worry, you are not missing the dulcet tones of Dave Moss. He is coming back. I'm just filling in for a few episodes. I'm Margaret Chapman, and I'm currently the board chair of Unfunded List. I've been with the organization for about 10 years, actually,
Wow.
which is pretty crazy. I started off as a volunteer doing so much copying and pasting. And then just through the years have grown with Unfunded List and the organization. So I'm super excited to be doing a couple of these podcasts for the summer, but don't worry, Dave is coming back. So today's conversation starts with a little bit of an uncomfortable question. What if a lot of the things that we've been taught about doing good, charity work, volunteering, philanthropy in general, actually isn't working as well as we think it is? Yikes. For decades, like billions of dollars have gone into all of this work in an effort to like do all the things, right? Reduce poverty, improve education, provide access to clean water and sanitation. Thousands of organizations have organized just tons of time and resources to go into areas to alleviate these problems, but they still exist, right? Yes, unfortunately. But our guest today, Susan Davis, is has written a book that explains a little bit about why some of these issues have existed, and for all of us at home, what we can do to improve the outlook for the future.
Yes.
You have a long history of working in this field, like 30 years. I want to say
plus
30 plus years. She started when she was 5. But you've been a Peace Corps volunteer, fundraiser, consultant, foundation staff member, leader in the global water and sanitation space. And of course, for all of us at Unfunded List, your most important role.
Oh, yes.
Unfunded List evaluator.
Yes.
Obviously.
3 seasons now, I think.
Woohoo! Yes. Your new book is Bullshit Without Borders. Let's change the way we change the world. Very exciting. It's a little memoir, a little satire, actually a lot of satire. I love that. And a lot of lessons that you learned by doing all this stuff all the years. So I know you care about people. This is not a conversation about like not caring. It's about how we can care better, right? It's funny because when I'm reading it, so for folks who know me, folks who don't know me as well, my brain works kind of in music. Almost anything you bring up can evoke a song.
Oh, yeah, same.
Brain.
Yes.
Which is kind of fun. You can't see it, but there are guitars all around us in the space that we're in today. And when I was reading the book, there are 2 songs that popped in my head and kind of just lived there. Actually, 2 of my favorite songs.
Okay.
One is Mahalia Jackson's "If I Can Help Somebody," and the other one is the Eagles' "Do Something." And I was reading it and I was like, oh, but maybe it's not quite as easy as just doing something, right? Like it's a little bit more complicated.
Yes,
than just
unfortunately it is.
So, welcome to Open Door Philanthropy, and you're going to tell us how to do something better.
Well, I'm going to tell you first why we need to change the way we change the world. Because if you don't know the history, somebody said, right, if you don't know history, you're doomed to repeat it. And that is the unfortunate story of much of development.
So like starting with history, can you give us a little bit about yours and kind of what brought you into development and aid and finally maybe with enough frustration to write a book about all of these things?
Yeah, good question. So looking back, I mean, my parents are both they're public servants. My dad was military and then he taught at a university. My mother taught high school English for many years. My sister's also a teacher. I'm the, weird one who went off and tried to do other stuff.
I feel that daughter of teachers who went off to do non-teachery things.
Yeah.
Yes.
So I kind of grew up thinking, I want to do something that matters or something that helps. I didn't really know what that looked like. In high school, I did this really cool, I was in Atlanta and they had the Fernbank Science Center. And you do this thing where you do a whole semester basically at the Science Center and learn all the different sciences, botany and limnology and biology and radiology and all kinds of things. We got to use the electron microscope. So I kind of wanted to do something sciencey. Yeah. Oh, super cool. Um, and we were out like learning how to graft trees and spotting birds and doing all kinds of cool stuff.
Well, my high school
Yeah.
didn't have that, but we had other good things, I
Yeah.
promise. But no, that sounds really neat.
Yeah, it was very neat. I'm very lucky that I got to do that. And then I also got to do an internship at the Centers for Disease Control, CDC,
Yep.
where I was helping the guy who was focused on malaria.
Oh.
And he was looking at, of course, this was many years ago, and he was looking at the resistant malaria, so malarial strains that were resistant to anti-malarials. And so that involved squishing a lot of mosquitoes. And
Oh,
I learned how to tell a female from a male. And we
seriously.
go into the insectarium and like pick out because the females are the ones that feed. So they bite you. And then they are the ones that potentially transfer the
Oh,
parasite and on all that. Yeah. So squishing up mosquitoes. And then we were, using gel, electrophoresis, and all kinds of cool stuff. So as part of that, I didn't really want to work in a lab, but the guy, Bill Brogdon, who was our mentor, would show us these morbidity and mortality weekly reports. There's an acronym I can't remember, but they would talk about this emerging disease. And so you hear, for example, like Ebola or hantavirus, like that. Those were the things they were showing up, saying, hey, there's this weird outbreak of a fever or respiratory or blah, blah, blah. And it would be around the world. And so that was super interesting.
oh my gosh. We have that today too. So it's
Yeah.
like so relevant.
Yeah, exactly. Right. And I, for a while, wanted to be, a disease detective. And then I realized you had to learn statistics, and I didn't like it.
Yeah, that stops a lot of people. Stopped me from a lot of things in my life.
Yeah, they never show that part in the movies where you're like, oh, they're tracking down where the monkey came from, and they're not showing them like
carry the T.
What is the R value of blah blah. Yeah. So
no.
So I didn't do that. Anyway, long story short, I went into environmental consulting, which at that point in life, my university basically was like trying to get people into, big jobs with engineering. I went to Georgia Tech. And so I was this lowly, biology major looking around, like, what do I do? And I was like, environmental consulting. That sounds cool. That sounds like you're hugging trees and doing cool stuff. And I got involved with water doing that, oil pollution prevention, hazardous waste sites where there might be groundwater contamination. And so that was interesting. And you would do, again, more calculations, and I called it like random number generation, but you try to figure out at a military site, for example, where they've been dumping jet fuel and pesticides and gasoline and all kinds of stuff into the ground. You try to figure out if somebody lived there and grew vegetables and had little babies rolling around in the dirt, would they get more cancers?
Yep.
And so that's human health risk assessment. And so that was interesting. And usually it'd be like, yeah, there might be out of, this many people, you might have 2 more out of 1 million cancers.
Okay. And was there like an acceptable rate? Like that was kind of a like, okay, well, 2's okay, but if it gets to 3, then that's
what's wild is, most cancers come from things we do to ourselves, and there's a 1 in 4 chance of getting cancer if you're a human.
Just generally.
Yes.
No matter what you do.
Yes.
Just living.
Yeah.
Oh, okay.
So
the more you know.
1 in 1 million is like, is that worse? I don't know. And of course, communities would be in an uproar because they're like, oh no, there's benzene in the water. And you're like, you're not ever going to drink that. So it's weird trying to get out of cleaning things up. It was strange.
Oh, because you turned around and then worked in cleaning water and trying to get people access to clean water in places where it may not be a 1 in 1 million chance of getting something. It's more.
Well, that's what I learned is just a friend told me. I didn't learn any of the stuff in my public health degree that kids were dying, 1 in 5 children were going to die from water they had to drink.
Right.
And I thought, whoa, here I'm generating these kind of weird numbers out of nowhere based on rat toxicity studies. And here's actual people and children dying right now from water that they have to drink.
Choice. Yeah.
Yeah. So the math, the practicality, even though I said I don't like math, but the math seemed obvious. This, maybe I should be less focused on this stuff and more focused on this stuff. And then getting there was not a direct line.
Sure.
But that's how I got interested in international development.
That's so interesting. And so the water, did that come from like the malaria studies, or was it something you happened into? Because I know your first thing was like in Poland, right? Which is not.
Well, that came from there was some detours before I got directly into water. But so I said, maybe I should get a PhD, or maybe I should, join the Peace Corps. What, I was looking, how do you get from
Excellent.
corporate world
Yep.
into this? There wasn't a direct path that I knew about. And so many people, this is still true, go into the Peace Corps and then they
Yep.
get into international development. So I thought, and I met somebody who'd just come back and she had a wonderful experience. So the Peace Corps at that time would just sort of send you where they wanted to send you. And
Okay.
they did have an environmental program, and I had, 8 years of experience. So they sent me there, even though I had studied French. It kind of made sense I would go somewhere that was Francophone. So I ended up in Poland, and I didn't, in the book, I tell a story about why that was not a good fit for me. But then I came back and I got involved with a group that I'd heard about before, which was Water Partners International. And their model was prescient at the time,
Mhm.
which was finding great local partners in Honduras, Bangladesh, India, Philippines, Kenya, and then they would fund them over a long period of time to do community-led water stuff. So all of these buzzwords you hear now, I accidentally fell into as my first entree.
Some of the things you talk about later, like we should be doing this stuff, like funding for more than 1 year, having community partners, letting them lead the way. No,
so I accidentally did that and then got out of it and then had to relearn everything.
Oh gosh. Was there one experience in like all of these, so many that you've had that was, I mean, that sounds like pretty significant, that particular experience, but like one where it was either the most enlightening for a good or bad reason, where you were like, I probably learned the most by doing X. I know there are certain ones in my life where looking back now, I can say at the time it may have not been the most amazing, but it has informed the rest of my life more than I thought it would at the time.
Yeah, I mean, I can think of several, but two particular examples. I'll start with the bad one and end with the nice one. One of them, and I talk about this in the book as well, is where I was an evaluator. I was going back after a 5 years after a program for water, sanitation, and hygiene in health clinics, rural health clinics, had been done. So I was looking for what worked.
Right.
And I visited several clinics in Ethiopia and Kenya. And one of the last ones I went to, I was looking forward to because I knew that it was right across the street from the office for the big, well-funded organization, what I won't name. And I thought, well, this one's going to be great, of course, because they see it.
Right.
And they walk by it every day. And so we went in there and it was the worst. So water, sanitation, and hygiene usually looks like there's some sort of running water supply. There is, there are toilets and there's hand washing. It's a health clinic. You got to have hand washing. None of those things were happening. And the worst part was there was a latrine. So, a building with a pit underneath it. And there were two sets, two for women and two for men. And that's great. They exist. The doors were gone on the women's.
I actually remember this story in the book. Yes. So I love how, first of all, sidebar on the book as well, I bet you go through the different, like, there's sections, right? So there's the parables and like this, what you call them, crap. So like questions you can ask yourself at the end.
Yes.
So I liked that. And I remember that story as one of the, I think it was one of a parable about the woman asking for help at the big, well-funded organization across the street. Like, did you know that I can't use that? My child is sick and they can't get running water right across the street from you.
Yeah.
That one was really a touching story.
That story haunted me because I was there to see what worked. It wasn't working. The INGO, the big international charity, knew it wasn't working. That's because their staff were with me. They were the ones who showed me where it was. They knew it wasn't working. The health clinic people knew it was working. The patients knew it wasn't working. And I wasn't able to do anything about it as the evaluator.
Reporting back.
I took some pictures and I told stories, but I didn't fix it. I didn't give my report to the government or, I didn't fix it. Nobody could fix it. And I thought, something is broken here. This is weird. Why are we here? And so I imagined that woman trying to hold them accountable. And who knows if that's still working, but I looked it up actually before a presentation. I looked up to see if that clinic is still there, and can't tell if there's water, but so they haven't fixed all the problems in that area either, so there's something wrong
about that whole
with the whole system. And I'm not blaming them either, because donors don't give you money to fix stuff. They give you money to build stuff in many cases. So there's lots of lessons from just
I want to talk about this, but I know you said you had a really good, happy
bright side. Yeah, and this goes back to kind of my first involvement. The very first place I went in a so-called developing country was Honduras, and we went to Western Honduras. And again, at the time, to get there, the roads were unpaved. You were doing low water crossings. There weren't bridges, so if there was rain, you couldn't cross. It's just muddy. So it was very hard to get there. It's very remote. And like in a lot of places, the poorer people were living in this very mountainous region. All the good land had been bought up by rich people.
Sure.
And so I remember a guy lowering himself down from a rope tied to a tree to farm corn that was growing on a hillside. So very remote, very rural. But there was an organization that has an acronym that's means something in Spanish, but it's Cose Pradil, but it's a community cooperative.
Mm-hmm.
And they had built these water systems they were capturing a spring. So they were building like a little box around, water coming out of the side of a mountain. And they dug these trenches and put pipes in. The community had done all this, the women,
Nice.
the men,
yep.
over time. And then they had piped water to their homes in this very poor, very rural, remote area. They had piped water to their homes. And these systems, I think when I went, some of them had lasted for 10 years. Wow. And this was amazing.
Right.
And that was super cool. And I'm like, what?
Right.
And
why are we doing this?
wow. Yeah. And I mean, but that was this was my first introduction to this is how it works. And I thought, wow, that's cool. And my job was to kind of raise awareness of the water issue in the United States and raise money and then give it to them to do the job.
Right.
That was cool.
That seems perfectly logical.
Right. So that was exciting.
Yeah.
And the really cool thing, so that was like late 90s when I went there. And then I later went back, we did this thing called an accountability forum, and we brought people to look at Cose Pradil's work. The idea was eventually that other organizations would host visits to their projects. So we brought in independent evaluators. We brought all these NGOs from other water nonprofits in the area to come and evaluate, but also learn. And then, at that point they had projects that had lasted 20 years. Because I was like, it's still working. This model still works. And they had expanded. People were staying in town, poor people's kids, instead of trying to go to the city, they were sticking around. So they were expanding the system. They were repairing old things. Like, it was great. And I'm like, this was the community doing the work. So that was super exciting.
That's the outcome we actually want, to develop local resources and have people be able to stay where they are.
And have you ever heard of this organization?
I have not. No.
Nobody I have ever mentioned this to knows who they are. And that's like, I want to make them famous. If I can do nothing else, like Cose Pradil.
No,
they're doing awesome work and nobody knows who they are because they have probably a marketing budget of zero.
Which I guess there's so many topics in your book that I definitely want to talk about, like the heropreneurs and all of that. Yeah. But let's touch on accountability for 2 seconds, because I mean, you were talking about it, and I know that's something that would be interesting, because you do talk about holding some of the NGO structures more accountable, and how can we do that better with, because it's a very unique structure, right? And it's very ingrained. And you talk about site visits and all that, but in terms of just how can we make that process better? Because you were saying that this group was doing it really well, and other groups aren't. But that one group that had the health clinic right across the street, like, how do we hold that group accountable for, even if that's not their project?
You want to hear my radical idea?
I do.
And then my slightly less radical idea. Okay, my radical idea is that communities would require any funder or organization to sign a contract that says, great, you can build a water system here. We're going to contribute our cash portion or our labor, but you have to come back in a year and drink the water.
Oh.
Whatever water we have. If it's the water from the system, you drink that. If it's the water from the hole that we had to go back to, you drink that. Everything would change.
Well, because you talk a little bit about in the book about you had the non-radical solution too, but you do talk a little bit about how when it's our own backyard, it's a little different. But then when we ship solutions off to other places, it's like, oh, that can work. It'll work for right now. We're not going to worry about 5 years, 10 years down the road. It looks good now. But if it's a solution for my house or my backyard, like I have a much more caring solution for that. So your less radical solution?
The less radical would just be like, give the phone number of the donor to the community and let them call. Because I mean, with Cose Pradil, they are from the community. They know where they live. They could be like, hey, Lionel, check this out.
Which you talk a little bit about the community feedback, because that would be the community feedback, right?
Mm.
And one of my soapboxes sometimes is financial reporting. So I am a finance person. It's
Mm-hmm.
true.
It's okay.
It's
It's okay.
okay. I care too, people, I promise. And so I'm often the one who is stuck doing the financial reporting
Mm-hmm.
for a grant, at the end of the project or every quarter. And it's a lot of paperwork, and I'm having to justify, why this or why that. And we have written a budget. And, I know you talk a little bit about things in the budget that may or may not actually be what's needed, right?
Mm-hmm.
And
Mm-hmm.
but that's what the funder wants to see is direct expenses for pipes or for this or for that. So my report has to be, we spent X amount on pipes, or, what all these things are. What if we I mean, we talk a lot about interest-based philanthropy, but
Mm-hmm.
what if we did focus more on the actual community feedback and impact, and less on, like, you said you would spend $2 on this thing.
Yeah.
You spent 250. What's up with that?
Yeah. Yeah. Well, gosh, and in Malawi, for example, the currency changes so dramatically that like what is $2 anymore?
Right.
And it used to drive me nuts. There are these things, especially in the former USAID world, for no cost grant extensions.
Yes. Yep.
Right?
Yep.
Which happened all the
All
time.
the time.
And basically that meant our project didn't finish in the strange arbitrary time frame that you decided it needed to
Indeed.
finish in. And imagine like trying to get water into schools.
Mm-hmm.
And trying to train kids on hygiene and all that. But the program starts in the summer and they're not in school.
Yep.
And you're like, well, there's going to be a delay because we can't start this until they get back to school, and when it fits into the curriculum and all this stuff. And also we need to train the teachers and all that stuff, but we can't because we got the grant at the beginning of
Right.
the summer. Or there's a rainy season. Lots and lots of places. There
Mm-hmm.
used to be a regular rainy season. Now that's all out the window. And there's, all kinds of droughts and erratic rainy seasons, but it used to be pretty reliable.
Yeah.
And people would say, well, we can't get the materials to the place. So, for example, in Western Honduras, all the roads are muddy. We can't get the pipes and the concrete and all that stuff there because
Yeah.
it's raining. And you knew that, and it always does. And why do you keep thinking this is going to happen in this time frame? So there's stuff like that that's just anybody who lived there could tell you, and they would if you asked them. But time frames, budgets, and I've been part of this, they're often determined in a room like this.
Yep.
In the United States. And we're like, well, let's do this. And well, especially if it's a corporate one, we're like, well, we really need to have something to announce by World Water Day. So
Yes.
we want to say that we got X, Y, or Z done and we reached this many people by World Toilet Day or World Hand Washing Day, because that's a good time to announce something and not a time that makes sense for the local conditions.
Oh my gosh, I have filled out so many NCEs in my life.
No cost
And
extensions.
no cost extensions, because I used to work for a cancer institute, and we would do a lot of patient enrollment stuff. And if you didn't get enough patients in, like, you had to just keep extending it, because we said we would get X number of patients to do this study, and we haven't yet. So,
Mm-hmm.
We need to keep going.
And that's like, do you want more people to get cancer?
Right. Like, we're trying to do this.
What are the incentives here?
Oh my gosh, the number of times I've done a no cost extension.
Not enough people are getting cancer fast enough to get them in the store. Is that?
Right. Like, sometimes it's really hard to spend. This sounds crazy. It's hard to spend money, which I know sounds crazy to people who might hear that. But if you have, this kind of goes back to the whole, like, letting the community do what what they need. When I have a budget that says I have to spend it a certain way, if things come in under budget, or like I can't get that part right now, or just something isn't working out time wise, like, it can actually be hard to spend the money that you have in a budget. You might need it for other things. You might still need to spend money, but not on those things.
Yeah. I mean, it's hard to spend money on somebody else's budget
Right.
and somebody else's time frame. I don't think it's hard to spend money.
Right. That's
yes.
Yeah.
But sometimes people will say, well, we only want to fund the stuff. And, the organization that's closest to the action is like, well, really what people need is just gas for their motorbikes. Say you want to create jobs. Well, they just can't get, they have to wait for the bus, and the bus comes once a day. They can't get to a job without fuel for their motorbikes or minutes for their cell phones. but that's not exciting.
It's not exciting.
We
I know.
give people minutes for their children, you know, like it's more exciting to say we built the thing or we created this many jobs and, you know. So.
I know. No, it's super true. So what do foundations, because you've worked in some foundations and you've worked with some foundations and you've seen good, bad, indifferent, what do they most misunderstand about what the communities need? And you said like just kind of now they need things that maybe the foundations don't want to fund, but what other things are they maybe missing about the actual work on the ground and how their funds are informing that work, perhaps?
Oof, gosh, so many things. But I think the big one for all of us really, and it's not just funders, is poverty is multidimensional and it's not the same for everybody in a community.
Yep.
So there was a fascinating study, sidebar, but there's groups that are trying to promote cash, like just giving people cash. And there's, cash with strings attached and cash with no strings attached. But anyway, this the study that I remember, and I might be misquoting it, but they gave people in a community some cash, and it wasn't a huge amount, maybe $100. And then they went back and asked people, how did you use that? And they would say, oh, we did X, Y, and Z. We put a roof or, blah, blah, blah. We purchased a motorbike so we could get to our jobs. And then they asked people next to them, what did your neighbors use their cash on? Which I thought was hilarious. Like, tell the truth. And the neighbors would say, oh, well, they used it to put their kid in school, or they used it to pay for their daughter's dowry for her wedding, or they used it for, which are all fine things. But they knew that the donors wanted them to do stuff that was like critical and basic and like, obvious,
right?
Like that they could see, oh, well, now you have a tin roof instead of a thatched roof, fewer bugs, less rain.
Right.
Good for you. That's a responsible way to use your money. And I just thought that was fascinating. So poverty is multidimensional. Not everybody wants the same thing at the same time, but that's not how we treat development.
Yep.
We say, and I have said this again, you might go into community and you do community engagement, right? And you're like, what do you need? And I'm like, well, we need paved roads and we would like electricity. And you're like, oh, so we have water. How do you feel about water? And they're like, okay, great, thanks. That's so nice of you. We will take the water, because we have decided that, and whether it's education or health or livelihoods, we have decided that's the fundamental thing.
Right.
And you talk to anybody, and I have said that water, you can't have anything without water. You can't, you have to have toilets and dignity and all that. We have decided that you get water.
Wow. And yet, because there's a story in your book that stuck with me, to that point where the funders want to fund one thing, but they don't fund the other pieces. So like you mentioned, a funder wanting to fund a school, but not thinking about, okay, well, we didn't include bathrooms and running water in the school. So yes, it's great that we have this building where people can go, but we didn't build a complete building. So like this focusing on like,
that wouldn't be legal here.
Right. So why is it okay someplace else?
Well, because, we've decided there are sectors, so there's been a movement over the past, I don't know, maybe 20 years now for water, sanitation, and hygiene in healthcare facilities, which is insane that we have to say that out loud. But the health clinic people have said, we need health clinics everywhere. Sure. Whether that's the government or an NGO or a funder, somebody's built all these clinics without running water, which is just a building.
I actually don't understand. I mean, a school, I still don't understand it, but education, but healthcare is very tied to water. So that seems very obvious that you would want to wash hands and all those sort of basic hygiene.
And they're like, well, at least they have a clinic. And like, does the building cause health? I don't think so. And I mean, again, we've somehow brainwashed ourselves into, well, health is separate from education, and education is separate from water, and water is separate from gender equality, and it's not. So I think that might be the thing. But I was just reading this chapter about the Millennium Villages Project, which was a Jeffrey Sachs thing. Oh, you don't even?
I don't even know.
It's another famous, maybe failure, but his idea, which wasn't off, but was that take a village and give them all the stuff all at once.
All at once.
The water, the education, the livelihoods, the computer training, everything, all in a package.
Village in a box.
Unfortunately, this was an economist, Jeffrey Sachs, and he didn't look at the history, which is why I talk about the history a lot, of what was called integrated rural development, IRD. which had been tried in the 70s. So these Millennium Village projects, I think we're in, 2000, like the millennium, right? And in the 70s, that this has been tried at like a massive scale and failed.
Yep.
And and all of this gets to poverty doesn't come because you don't have a project.
Right. Yes.
There's deep root causes, right?
Yes.
And that's depressing to talk about, and it's frustrating because you're like, but I want to help. And so,
I mean, even domestically, a lot of the groups I work with, especially locally here in the DC area, work on the prevention and reduction of homelessness and poverty. And there isn't a one size fits all reason or solution to any of it. Yeah. And so to have someone think like, oh, we just check this box, everything will be better. Which actually kind of the Jeffrey Sachs idea brings me to one section in your book that I spent a lot of time on and really hit home was the heropreneur section. So I have a story that I tell, and you all may have heard it, everyone may have heard it at some point. It's called, Are You Going to Crush My Dreams? So this was actually probably close to 10 years ago at this point. I was at like a leadership conferencey thing, and at the end of it, everyone got 60 seconds. So all of us in the room, there's probably 30 of us, we could get up and literally do anything. You could do a dance, you could tell a story, you could share an idea. Like you had 60 seconds you could stand there and do nothing, like 60 seconds to do something. And I sadly don't even remember what I did, but I remember that a gentleman got up and he shared this idea that he had about a problem and how he wanted to fix it. And it was a good idea and it was a real problem. And I remember going up to him afterwards and I said, oh, I heard your 60 seconds. I hear you. That's a real issue. I actually work at unnamed, very, very large nonprofit with a whole lot of money. They're also working on that idea. Can I put you in touch with so-and-so over there? And maybe you can, work with them on this idea. And he looked at me and he said, are you going to crush my dreams? And I was like, okay, so your dream is to be a founder, not to actually fix this idea, fix this problem, right? So I really resonated with the heropreneur section. Can you share a little bit about what a heropreneur is and maybe why you wanted to include it here as part of this?
Because you run into them all the time is the short answer, but I have the definition, and this came from Daniela Pappy Thornton, who was, I think at the time, working with the Said Business School at Oxford.
Okay.
And she tells the story about, and I've kind of mentioned this too, like when I was in college, the dream was to get a job with a company, and they would pay health insurance, and you would work at that job until you died. And somewhere probably in the mini depression, there weren't a lot of jobs. And so people had to make their own jobs, which is entrepreneurship. And so colleges started teaching entrepreneurship.
I teach entrepreneurship, so I can't say much about this. And say it's even social entrepreneurship. So
look out.
Some of my former students might be heropreneurs in the making.
Yeah, I was trying to find the definition that she has. Here we go. It's the way she defines it is a heropreneur is a founder who is greatly admired as if a hero and viewed as the main actor in social progress, or a person who starts an organization and who overemphasizes their role as founder, overshadowing teams, collective impact, and building on the ideas of others.
Interesting. Yeah.
And so the reason I wanted to talk about this is, and I laughed when you said dream crushing, because I started a class at Georgia Tech that I jokingly call Dream Crushing 101, and it is intended, the official term is like deep dive into social impact, but the intention came out of watching a contest they called Ideas to Serve. And it started again with good intentions. My colleague, Dory Papp, she's wonderful. She was in the business school at Georgia Tech, the Scheller Management School. And they had all these contests for people coming up with, gadgets and apps and technology. Georgia Tech is like technology. And they would say, we invented this thing, and they'd get, become the unicorn and sell it. And
it's great.
That's exciting, right? And Georgia Tech's like, look at us, we've changed the world. And so she's like, well, what if we do something that's like good and not just to make money? And so she called it Ideas to Serve. And
Okay.
students would come in and they're like, I invented an app to do blah, blah, blah to fix mental health. Or, I mean, they had really interesting ideas, and there is nothing wrong with that. But they would get some money. They would get $5,000 or something, and then they would go do that thing. And they are 19 years old. And
Yeah.
whoa, whoa, whoa. And a lot of them would do something that they had read about, hunger or homelessness or mental health issues. They had not had lived experience. They were not part of that community, whatever it was, whether it was somewhere else. And there was one group that ended up winning a prize, this group of women, and they had this really cool lotus thing that it was copper and it was going to, make water safe as it was stored. Great. Nice idea. Then they went off and started a business and to do this thing, and it was going to be in India. None of these people are from India. They had been there on a visit for like 2 weeks.
Okay.
And I saw them, and they were on stage, and they won this prize, and I thought, I should crush their dreams. I didn't think that immediately. I was like, maybe I should just let them know, because I had been studying for a year and collecting all this data on point of use treatment, which is right before you drink it. And so I was like, hey, can I meet you for coffee? And they're like, oh my God, it's the Georgia alumna. She wants to like give us money. I don't know what they thought, because they were very eager. Yes, we will meet with you. And then I plunked down, here's a pile of paper. And I think I had a thumb drive at the time. And I was like, I'm not sure if you're aware. Like, first of all, congratulations. Second of all, everything you're talking about is going to fail. And but in a nicer way.
Sure.
Like, here's some data, here's some evidence. And then I could just see their faces like, and they were like, thank you so much. And they went off and they did it anyway.
Sure.
And about a year later, they came back and they're like, so everything you said was correct. And Shannon Benchek still says this stuff. They did pivot, and now they do like lead testing, and they're very successful. And this was before there was like some, I don't know if that still exists, but a US policy for like removing lead pipes.
Okay.
So they were like ahead of the game.
Great.
And still focused on water quality. Awesome. In the United States where they live.
Excellent.
And they're doing great. But Shannon says this, you were the only person who said anything critical, because we get excited. All of us do too.
All of us. Yep.
We're like, oh my God, you care about something. That's so cool, because I am, stuck in my corporate boring job where I'm making $1 jillion. But this is so cool that you're willing to be poor and go help other poor people. I mean, and that's kind of the ethos of tech and probably other places. Like, good for you. Good job.
Right.
I'm so proud of you.
Well, that's kind of unfunded list. Not that we are rude or mean about it, but so often that's the feedback that maybe some of the first times that folks have heard feedback that is somewhat critical of their idea. And again, not in a mean way, but in a, have you thought about the impact of this? Or have you considered why? And I think, the history part there, when you talked about it, like I see that in some of the students in these classes, they have a really cool idea. They've seen a problem on TV or what have you. But the idea is not bad. It's just, it needs a little bit more work before it immediately gets implemented. A little bit more of the history, a little bit more of nuance. The ones that come out of the class that I'm like, that was amazing, are people who have a lived experience, who have lived the problem, and they're like, this is the solution that would have helped me. And then their ideas, and they're doing them for a different reason at that point too. It's because I saw a thing, I lived it, and now I want to help others.
And I'm not saying all of these ideas are terrible, but if you were interfering with somebody's life, you don't get to like fail fast and fail forward. That's not okay. It's probably not even legal in some places, honestly.
We'll test this theory on you as a human.
Like, would you drink that?
My gosh.
Yeah. So there are two tools for that in particular that I like to use. I don't want to just be negative all the time, negative Nelly, but Daniela Pappy Thornton came up with one that we used in the class that I teach, which is called an impact gaps canvas.
Okay.
And it's basically, it's just a worksheet, but it's like, what have other people done about this?
Yes.
What is the actual problem? What's the root cause? Think about that. People are hungry, don't throw a sandwich at them. That's not going to fix it. Long term. And then, who else has tried this? What have they done? And then the part in the middle is what she calls the YOU shaped gap. Like, where do you fit? And, if you do your research, like probably are going to find out you need to learn more.
Yep.
You need to apprentice to that problem is the term that she uses. And then there's another one that I like to use called the pre-mortem. And this is a business thing, but I adapt it to involve like looking back at the research.
Yep.
And the pre-mortem, you get all these different people in the room and say what could go wrong. And that there is something psychological, there's some science behind that, that flipping it that way will get more information out, you know, thinking about the future, like why is somebody writing a negative article about us?
Right.
You know, why are people suing us in court? You know,
like imagining what could happen, like that's negative, and then
and then sometimes you say, whoa,
actually
we should not do this at all. And I ran through this exercise with a donor one time, and they were looking at a water project in I think it was in Eswatini, and the well that they wanted to drill, they tested the water already and it was high in fluoride. And I was like, do you want to be associated with fluoridosis? You know, we're have skeletal problems. Yeah. Like it's bad. It's not fixable. And fluoride is very hard to get out of water, weirdly. Like we have it in our water, but it's expensive. It's hard to get out. There's not, as far as I know, many technologies that are feasible for a low resource setting. Same with salt, actually, and arsenic. But anyway, getting technical. But anyway, they ended up saying, well, what if we move the well? And yes, it would cost them more to do this. You know, and the funders like, we are willing to pay for safe water. But the organization was afraid to ask for more money. They said, well, you said, you know, we only get this much. So they didn't want to tell them that this well might be, and it was horrifying just to see that in action, because this was a very nice donor. She just didn't know. She's not an expert on fluoride, and they were afraid to say anything to her that this might fail because they really needed the money, and they were probably going to figure out how to find a different water source. But still, you know, we're so afraid to talk about failure, especially in the nonprofit world where you have to, everything is wonderful and shiny and cool, and we're cooler than them and we're better than them. And
oh my gosh. So actually that is such that's where I was going to head next. So yay. Really quickly, I'm back on the Hairpreneur for 2 seconds. We do have a webinar for people listening from Unfunded List a couple of years ago, actually right before the pandemic. Russ Finkelstein did a panel on founders. So what is it like to be a founder? And then immediately afterwards, I did one on you don't have to be a founder. And I talked to some really lovely individuals who are doing amazing work in their field, who are working for organizations and people and for things that they did not start. And just how can you call them a sidekick, right? And that's one of the solutions you have, right? And so I think just a plug for the Unfunded List webinars around being a founder and not being a founder.
Oh, I'll have to look for that.
Yeah, it's really fun. And the folks we have on both sides are amazing. And the founders have done really great work, and they are solving challenging problems, as are the people who did not start something. And so it was fun to kind of see the two sides, because a lot of people think they have to start something in order to have an impact. And it's like, I didn't start Unfunded List. I've been here a long time, but it was Dave's idea. I don't feel like I have any less of an impact on what comes out of Unfunded List because my name isn't next to founder. So I think it's an important thing, I think, for folks as they're maybe going through their nonprofit journey to think about. Well,
and if you're talking about poverty, it's huge, right? Huge. It's huge. It's endemic. It's a lot of places. It's multidimensional. Why not work together? Why not work with other people? Why not collaborate? Why not work in collective action? You know, why not lend your skill set to something existing and make it better?
Which I think is one of your first things when you talk about how do we change this up, right? How do we make this better? Because you've gone through, and we only touched on a couple of the sections, because I also found it interesting, the celebrity piece. You have a lot in there about that, which I find fascinating, and also agree with. Corporate social
celebrity foundations, not trashing celebrities.
They're delightful. If you want to fund Unfunded List, we will also take your money.
And Maya Ridolph, call me.
See, we love celebrities, not a problem. Just when they're doing it for the right reasons, right? And
again, why do they have to start their own foundation? I guarantee anything they discover as a problem has somebody working on it, probably close to the action. Like,
then
Yeah.
you can do the worksheet, right?
Yes.
And figure out where
It needs to
they
be a
fit.
celebrity impact gaps
Yes,
canvas. Yes.
I like it.
Yes.
That'd be fun. So there's so many other sections
Mhm.
in the book that we just no, I mean, we don't have time to talk about all of them. The list of questions I sent you was it's a book in and of itself. So I recognize there's so much to talk about, but I want to make sure we have a chunk of time to talk about next steps. Like, what can we do better? And the first one that you talk about is the one you just mentioned, the cooperation instead of competition.
Mhm.
So in your mind, like what does that look like in this like ideal or even pseudo ideal world where there is more that collaboration than competition?
Yeah, and again, I'm learning from lots of other people, but there's a movement called Collective Impact. There's a whole group called Collective Impact Forum. And I think we need to make collaboration sexy again. If you talk about, there's a story in the book where, these people got together and blew up a dam
Yes.
that was blocking a river, and not advocating for explosives,
Yikes.
but nobody knows who they are, but people know, the one person who did one thing. And even movies are like that, like Malala, and, we know about Machine Gun Preacher and Greg Mortensen, and we like to focus on that one person. And there's, a quote that movies hate meetings. And collaboration is all about meetings. It's about talking to each other. So I worked for this organization called Agenda for Change, which was at the time 14 pretty big international nonprofits, a couple of smaller ones. And their whole thing was like, can we work together in the countries where we are to, influence policy together, to establish best practices, and that sort of thing. And one of the smallest things that was so interesting, first of all, they didn't, the people who were collaborating were mostly, the European and Americans. And we were having conferences and we're like, let's get together. And then
we love a conference in a nonprofit world.
Right? We're like, oh, who's not here are the people in Ghana or Uganda who are actually doing the work. And when I started just thinking about that, I was like, well, are you guys collaborating? And they're like, we don't even know who to talk to. Also, we're very busy trying to meet these weird schedules.
Right.
We don't have anything in our budget that allows us to meet with other people. It's not in our performance reviews to spend any time talking to anybody. Wow. It is not part of my job description to collaborate. My job description is to finish this project, or manage this project, or to do whatever. It's not to talk to other people. And so there's very simple structural things that those organizations started doing. And one of them was that we took some of our budget for the secretariat, which is what I was running, and we said, would you guys like some money to have a meeting? Nice. To rent a hotel room and get some snacks? And they're like, yeah, that would be amazing, because we don't have that. And
oh my gosh,
very simple things like, here are the email addresses for the other organizations that you probably pass in the grocery store, right? I mean, you guys should talk.
It's interesting. One of the organizations I worked with, which unfortunately has now ceased to exist, was an international organization focused on climate change and capacity building in Africa and Asia. And while we had an office in DC, it was a very small physical location, and most of the staff were not in that office at all because they were out in the field. They were out. I mean, our entire budget from all of our funders was essentially go and talk to all the people who are also doing this and learn from them, teach them, go to where it's needed. And, we don't know what the answer is. So go and find other people, talk to them, work together to figure out the answer. And I thought that was a really cool model because as their finance person doing their finance reports, it was actually some of the easiest ones I ever did because the grants were essentially go do stuff.
Yes.
I mean, they would have some parameters around location, perhaps, although very broad, West Africa. Okay, great. Or Japan. Okay. It was very broad parameters, but it was essentially go and figure out who's doing the work, how we can learn from all of this, bring people. It was a lot of collaboration. So we would hold meetings. The whole budget was to bring people together in the same place in the community and learn from each other, teach each other.
So valuable.
It's amazing.
Yeah. And that's where, I mean, before collaboration, before cooperation comes trust.
Yes.
And the first part is like, who the heck is that?
Yeah.
And the nonprofit world is very catty and very competitive. I mean, it is because we had to be, and donors want us to be. They're like, tell us why you're better than them, right?
It's a whole section in a grant proposal that we get a lot of feedback on is explain why you're different. Explain why I should fund you and not so and so.
Yeah.
Yeah.
It's
It's
it's wild. You know, we're all trying to solve the same problems. And anyway, so first comes the trust, then comes the integration, you know, and the learning. You're not going to learn from somebody you don't trust.
Sure.
And then you realize, like, oh gosh, we could learn from you, or I do see how we could work together. That is not done on the time frame.
Yep.
Right.
Yep.
And it's not done on the side. It's not extra.
It's
somebody has to support that, you know, and there's a lesson for donors. Support collaboration, pay for that, support learning. Build that time in. When I complain about nobody's reading these reports, it's not, there's no place in your job description or in a program where it says, go learn what happened in the past. Go talk to the community before you build anything, before you talk about anything. Listen to what they want. Retool the whole proposal if that's not what they want.
Which is crazy because in my non-unfunded list life, I help nonprofits write strategic plans, ironically. And the first step in any good process is to read everything you've done before, right? What have we learned before? What have we tried before? What worked? What didn't work? Who are our partners then? Who are like just, as you said in the very beginning, if we don't study history, we are doomed to repeat it. So how do we not spend time? But you're right, we're not paid to do that. No. Unfortunately, we're paid for impact and outcome.
Who else has tried this?
Yes. Yeah.
And how long ago? You know, in that case of the Millennium Village projects, you know, 1970s probably seemed like the ancient times. Like, did they even have paper? You know, they definitely didn't have PDFs, but that information is in people's heads.
And there was probably a study written about it somewhere. That's
there are. There's lots of them on the World Bank site. Nobody's reading them, but
but you talk a lot about like locally led as well. So not just collaborate at the top, but also what does that look like to focus on like local solutions, local issues, and like having it locally led and not top down led?
Yeah. I mean, the cool thing that I am recognizing is, you know, localization and locally led have kind of been buzzwords in the world that I'm familiar with fairly recently, 10 years or so. It's all been happening the whole time. Like for all of history, people have been solving their own problems. Yeah. And that's the easiest way to think about it. And, you know, and I've been in rooms where, you know, foundations are saying, you know, we want to give 25% of our money to locally led, but we don't know how to define local. I'm like, come on, you know what it's not, you know.
So long we couldn't physically get from one place to another easily. So it's what has been, you're right, has been happening since the beginning of time.
It's been happening all the time. You know, people were helping other people build barns, or they were, you know, digging water holes, or they were, you know, taking care of each other's kids. People have always been solving their own problems, and they're, you know, so as an outsider, you know, you could look at, is there a way I can remove a barrier? And that barrier might be access to funding. Just give them the money, let them do it. And again, people say, well, what about corruption, or what about this or that? And that's where the trust comes in. Just get to know people. It's so much easier now. I talk to people all the time who are in some remote area. There's Wi-Fi, there's WhatsApp, there's cell phones. Get to know them. And if anybody is like, I don't know who they are, I will tell you, there's somebody doing anything you can imagine right now and doing it very well with like a shoestring budget. And they can handle more money for sure. And some of those folks, if you were like, oh, but I really want to do something. So from somebody like me, I could help connect them to each other.
Exactly.
You know, maybe they don't know, they don't get to travel to even the city very often. So they don't know that there's an event going on. I can let them know about that. I could help. I have all kinds of random resources that I've collected throughout. I can say, oh, here's a list of donors that you might look at. There are all kinds of ways that we can help that don't involve parachuting in, right?
No, it's very, buzzwordy right now, the trust-based philanthropy model. And there's lots of commentary, good, bad, and different, but a lot of it is kind of going back to some basics of just, I see a problem, I want to help it. The easiest way is to let people who know what the problem is and how to solve it, just to give them the tools they need. Right. And that's essentially what it boils down to. multi-year grants, trusting that they know how to spend the money, just general operating support, and being like, I'm just giving you the tools. Like, I trust that you know how to fix this.
Yeah.
And
Yeah,
then
and then
with you.
community-led development
Yep.
sounds a little harder to support, like if it's community-led, who does the money go to? But there are ways to do that. Don't worry, there's a whole movement for community-led development that I'm an individual member of.
Nice.
There are lots and lots and lots and lots of tools. If you kind of have to open your eyes to like, oh, I don't need to solve that myself.
It was really, I was on a call yesterday and learning about a community foundation where I'm from. I'm Appalachia, from West Virginia, and the community foundation serves almost like as a fiscal sponsor for ideas in the community. So someone has an idea for a fix of a problem. They're not going to start a nonprofit. They're not going to do all of that. Yeah. They just want to raise a few dollars to fix this, specific need, and have some place where the money can go where people feel confident and, can kind of manage that piece of it. And I was like, that's such a community-led idea, as someone in the community sees a problem, says, here's the one thing I can do. It is discreet and it is one-off, and there's an institution that says, we will help you.
Yeah.
We'll be your funnel, we'll be your support.
Yeah.
And then the problem, it gets, fixed perhaps, but it was such a neat idea. Like, I know that's not a revolutionary idea, but it was for that community. Like, someone didn't need to parachute in and give them $10,000
or check up. Like, did you fill that pothole? Yeah.
We fixed the problem.
Why wouldn't we fix a problem that's affecting us?
Exactly.
Why wouldn't we take care of something that we need to use?
Yeah.
We're gonna use this water every day. You're not. Like, why wouldn't you trust us to keep that running?
This is for our best interest. We want this to be good. Yeah. Which kind of leads me to another thing you talk about, and that you talked a little bit about today, that ability to embrace risk and failure. And that, the idea that sometimes these ideas might not work, right? And how do we measure success on the funder side and on the grantee side and on the organization, like all these things, acknowledging that sometimes success is learning what not to do. Like, how does that kind of help us change some of this? You talk a little bit about that in the book. Like, how does that change?
Well, if you start, first of all, we should know what not to do, at least in water. There's lots of documentation on that. So we don't have to like worry. We know what doesn't work. Outside led, short-term projects, blah, blah, blah. Low, saying, oh, well, we're going to do the cheapest possible thing. That doesn't work. It doesn't last. It doesn't help anybody. They don't move up the ladder of services. Just give them all the access at home, all the water they need for all the health things. It will last because it's convenient. It's what they want. They will pay for it. They will maintain it. I get mad about the R word, risk.
Okay.
When it comes out of a philanthropist's mouth, because what is the risk to you?
Right. Your money is.
I always what do you mean when you say risk?
Yeah.
What does that mean? Because if foundations were very worried about risk, they should be horrified at the extensive failure at scale that we've already accomplished.
Yeah, true.
Clearly our definitions of risk are different because the risk to the community is
there
high if you keep doing this the way you are.
Yeah.
So if they were going to go drink the water, then they should start worrying about risk. But otherwise, I don't want to hear it.
Yeah. No, that's an interesting kind of tweak on the idea of risk, right? Like, the risk is already there for somebody.
Yeah. Risk of unintended consequences, definitely. Sure. Think about that. The consequences are happening all the time of unintended. So I don't know what people mean when they say risk.
Interesting.
And probably it's reputational.
I would get over it, that,
because nobody's going to come back and tell you that it failed. So get over it.
Well, that's the thing too.
You're fine.
A little bit about like that transparency and being able to tell the funder, and this didn't work the way we thought it would. Or to your point earlier about the no cost extension, we didn't actually hit all the metrics in the time allotted. Like, being able to have that transparent conversation and say, but we learned this other thing and now we want to pivot. And, being able to have that conversation and know that the funder isn't going to penalize you for saying,
Yeah.
We learned things and now we need to pivot.
Yeah.
To your point about the fluoride, and you're like, we need more money because we learned something. Like there shouldn't necessarily be that fear of,
Yeah.
we have more information. More information is great.
Yeah. Yeah. So one of my friends, Marla Smith Nilsson with Waterfur, she's taken that model that I learned about when I first entered the international development world. She raises money in the US and finds great local partners. She's still working with COSE Bradil in Honduras. She has Kwaho and Kabda in Kenya, groups you've never heard of, but they're doing awesome work, and they're getting piped water to the home. She asks people, so she goes and visits once a year or so, and it's not to penalize them, it is to learn.
Yeah.
And what she asks, she doesn't have, she probably does an extensive checklist, but her main question is, what have you changed in the last year and why? And that's where you know you're paying attention.
Yep. Yeah. No, I love that, because I mean, what have you changed? And because you've learned something, right? Yeah. You didn't just change it on a whim, like some new information came up.
A policy changed or something, you know,
changed.
Yeah. Or there's a better technology available, or a better pipe or something, but that means you're paying attention if you change that.
An unfunded list after each round, we do what we call an audit, a process audit. And we invite evaluators, we invite applicants, we invite everybody to join us. It used to be a much more secluded thing. Like we would go and just sit down with a giant checklist and go through every email that was sent, every step of the process. And now it's very transparent. We want folks to tell us what went right, what went wrong during that process. And every single round we make an update. It may not be the biggest update in the world. It may not be a whole new CRM or system, but it might be, now there's a little NA button that you can click instead of having to write NA on your evaluations. It might be a new question that people are like, I really want to answer this. Okay, great.
Yeah.
Let's add that to the question set. So I love the idea of asking, what have you changed? Because I think even internally for us, we could definitely answer at least twice a year. Here's what we changed.
I would like us to be able to ask foundations. What have you changed? Yeah.
That's one of the things.
Based on your evaluation, people are paying a lot of money. The bigger foundations, USAID, pay for a lot of money for evaluations that they don't use.
Yeah.
They don't adapt based on them.
So if there's any funders out there who want to partner with Unfunded List, we have worked with several, and we review like groups of their proposals, and we give the feedback to the applicant, but then we also give feedback to the funder, and we say, here's what our evaluator said about your application.
I do like that question in there about what would you tell the funder?
I mean, we have found that funders have taken that to heart, and several have changed their question set or their process, or added, a little thing here or there they've learned. So again, going to, if I don't think all funders, we do a lot of conversations with funders and with applicants. And I don't want it to sound today like this is an anti-funder, and funders
there's some great
funders. And even the folks who are doing things in a way that is not ideal, a lot of the times I truly believe they're not doing it on purpose to be that way. It's just that what they were taught, right? Or what they think they should be
considered to be a best practice.
Exactly.
And the point you just made about you collect information from third party, essentially.
Yes.
Neutral people who are not their grantees. They are probably, they might not have any brave grantees.
Right.
But all of those grantees might have said those things to them.
Absolutely.
But they're like, oh yeah, you're just disgruntled, blah, blah, blah. But if you hear it from somebody neutral, all of a sudden it makes sense. So there is a role for the sort of outsider to say, that's interesting.
And I think, with water too, like there's a lot of things that, again, going back to learning and incorporating that on both the grantee and the donor side. There's a lot of opportunities for the whole process to be better on both sides. I think there's just, we can all learn a lot. I think we've come a long way in how we do some of the work. Obviously there's a long way to go. There's a lot of problems still out in the world, but if you could look 20 years ahead, okay, and everyone's listened to this podcast today. They have read your book. And
they took
extensive notes, much like I did. And they have incorporated at least some of the next steps and the things they can do to kind of improve the whole like kind of philanthropic sphere. Um, what does that look like for you? What does success from this look like 20 years from
Oh
now?
gosh, let's see. Is this dream?
Dream
Okay, dream world.
Yes.
They're all of the foundations that exist today
Uh-huh.
are gone.
Oh, okay.
They've spent their money down.
Oh, all right.
They gave it
Not
away.
5%, but they are
Okay.
out. They're done.
Yeah.
Okay.
Because there are immediate urgent issues.
Mhm. Yep, there are. No, there definitely
And
are.
I read something, I wish I could remember who said it, but somebody said, "What are you so worried? Do you think that no new wealth will be generated? Are you that unimpressed by your offspring that they're not going to go and make just as much money as you did?"
Yeah. I think we've proven wealth is generating pretty
more and more and
consistently.
more, right?
Yeah.
So what are you worried about? More money will be created. Spend your money now. Get the credit while you're alive.
There.
Go for it. Of course, there's the legacy ones, but spend it down. All right. So in 20 years, there might be some new foundations. I hope there's a new model. There's not people who need to put tax shelters. There's a whole new model. So there's no more foundations.
Okay.
And they've spent their money in all the great ways: trust-based, community-led, locally led, invest in their own communities, on and on and on. All right. So magic wand, that's happened. There is no such thing as international development.
Okay.
There's global public investment. The economy has changed so that we're investing more in all of us are investing in our own communities. There's no more debt servicing payments that outstrip countries' health budgets. That is an area I had never heard of until, I don't know, it's embarrassing. Like the past couple of years, it's like, wait, what? Some countries are paying more in debt servicing to rich countries.
Yep.
So like the banks, right?
Yeah.
Than they are for their own health and education budget. Why are they poor? Because of that. It's so crazy. Yeah. Oh my gosh, there's another book that I need to reread, but called Confessions of an Economic Hitman. If we want to know why countries are poor.
As a former economist wannabe, now I feel like I need to read that one. I did not read that one as an economics student.
It will open your eyes to like, oh, this is why all these problems are still happening in these countries. So the aid is like a teeny tiny percentage of these much bigger things in action. So that's gone. That's not happening anymore. So there's no more debt. People are investing in their own countries. There is learning, like the US is learning, like, how do we deal with our water scarcity issues that are rampant and happening, right? There's people without running water right now in the United States and the boundaries. And it's not just, it is in Appalachia. It's not just the Native American reservations. So we're learning from other people. We're like bringing in experts from Kenya and, the arid lands of northern Kenya, and we're learning from them. What else is happening? There are no more silly songs about we are the world.
Yeah. Oh my gosh. I did appreciate there was one section of your book where it's like flashlight at like 2177 or something.
Oh, the
like
Great Aid.
Yes.
Museum of the Great Aid Era.
Yes. And you had a playing of We Are the World or something. And I was like, yeah.
So I'm thinking as I do the audiobook, am I going to hum that part? Oh.
Yes, it's a classic.
Yeah. You don't want to have to get the license for this.
No, I think we're gonna just that little blurb.
Yeah. No, what else in 20 years?
Because you talk a little bit too about nonprofits working themselves out of a job. And I know that when I've worked with specific nonprofits, when a funder especially would ask us like, oh, what does success look like for you? And our very cliched answer would be that I'm unemployed from working here.
Yeah.
So on the nonprofit side, because that's on the kind of donor side, the foundation side, on the issue side, what does that look like? Have those problems been solved? Are there new problems? I'm sure there's new problems because there's always new problems.
Well, that's a really timely question for right now, because there are all these people who are ripped out of social impact jobs.
Yeah, true.
Illegally, I think. And a lot of those folks are now, what do I do next? And so I think it would be useful to have a career path or a pipeline that is useful, right? And there are organizations that are helping nonprofits think about merging or shutting down ethically. There's a really cool example of one, I don't think I put it in the book, but called Watershed. And they started in Cambodia with the explicit idea, we're going to go out of business in, I think it was 15 years.
Mm-hmm.
And they were about toilets, getting toilets out. And they worked with everything in mind, like that from the very beginning. And I think that's what organizations have to do, is think about that. When I worked at CARE, in it's like the 2000s, they were, I won't say celebrating, but commemorating 50 years in Haiti. And I just looked that up for this book. It's like, now it's been 80 years or something. And they were proud, like, we're the biggest employer and we've been in Haiti, and Haiti is not better off because you were there. What? That's not, what are you talking? And you're all about fighting. Why? You should not be proud of this.
Right. Why isn't the job fixed?
Like, just stop it.
Because you mentioned that a little bit about this idea of working yourself out of a job. And yet when they revisit, 20 years later or whatever, and still have the same goal of working ourselves out of a job, well, are you closer to working yourself out of a job? Are you, like, how far away are you from that marker?
I would say this to young people, and they're like, I don't want to work out. This is my career. My identity is helping people in other countries. What do I do next? We're not very clear about what else is there besides saving the world. If the world is saved, then what do you do next? And I think developing some kind of clear, useful pipeline that makes people feel valued without hurting other people, like that they can add value and feel valued, I think would be really cool. I don't know exactly what that looks like, but in 20 years, we figured that out.
Because I was going to say, at one point, because throughout the book, you challenge this notion of saving the world. And at the very beginning, you say, if you were to explain international development to a 5-year-old, you would say, well, my job is saving the world. It's a little more nuanced as you get older, right? But if the goal of, some of these organizations and some of those folks is not necessarily saving the world, what is the right goal that we should be kind of thinking about?
Well, I think that the saving the world is sort of an us versus them kind of thing. I mean, we all live in this world, right? We're all part of this world. And I mean, you could look at climate change and say, if we don't all deal with that, there's no world to save. Well, the world will be fine. The earth will be fine. The peoples will not be fine. And the animals and the flowers and all the nice things that we like to look at and eat are going to be gone. And the water. But like, living in the world or taking care of the world, and that should all be our responsibility.
We should all be saving the world in our own way. Like, every day there's a little bit you can do.
Save your own world.
Save your own world.
And I don't mean this like I wrestle with this. I don't mean we shouldn't care about other people, but are we the right ones to solve their problems, or can we get out of the way or advocate for policies in our country that are affecting their country?
I do appreciate, because at one point you talk about to save others, I save myself first a little bit, and like if I can change something in me, then that allows me to do more. Like if I am a nicer, kinder person, and if everyone did that, then would the world be a little bit better place? So like we can all support outside improvement, but also there's something to be said about internal improvement.
We have to change ourselves, right? Before you change the world, but that's hard.
It's hard. That's a whole other podcast. I'm getting into my own self-help right now.
No, it is. I mean, it's like the people who are like, well, if only I could, eat healthier. I'm like, well, you're in charge of that, aren't you? Like,
I mean, I am, but those little bun cakes are so delicious. It's so hard.
Yeah. So, I mean, it feels good, and it feels, I got to be honest, like, going to another country and doing something, whatever I didn't actually build any water projects. I evaluated stuff. I went to meetings, I wrote reports, I took pictures, I wrote stories, and then I came home and I didn't have to think about those people anymore. And I got to check a box somewhere in my ego that said, I feel good about that. So in one way, the world is a lot more connected now than it used to be. So maybe if I was going to do that again, I'd be like, here's my WhatsApp.
Stay in touch.
Text me.
Let me know how it's going.
Yeah, what's going on. And I do now. It's kind of wonderful because of the networking that I've been able to do. I have people contact me and they're like, can we just talk? And they're, from people from Kenya and Burundi and Malawi and Tanzania, and they're like, I just would like to talk to you. And most of the time, like, I don't know if I can help, but I'm happy to learn what you're doing. And they're doing really cool stuff with very small budgets. It's amazing. And I wish that I did have access to somebody's money that I could be like, boom, here you go.
Yep.
Because, and I was thinking about this, like, okay, if I was going to say to you, like, you should fund this person, I had a 20-minute phone call with them, and you'd be like, what are you talking about? But think about this. I have a friend who organized this talk by a very well-known water hero. And she's like, yeah, my company gave him like $1 million. I'm like, really? I wish you'd talk to me first, because he gave a great talk on a stage. He has a great story.
Yep. He's here for now.
And that was enough. They did not look any further than that. He told a great story. And I'm like, well, I just heard a great story. Why shouldn't I give them $1 million? What's the difference?
Oh, it reminds me. So I just finished my regular rewatch of The West Wing, which I like to do.
Okay.
Just,
This
sometimes.
Is more than once. Okay.
Yes. And at the very end of it, they're leaving office, and CJ Craig, who was the chief of staff at the time, Alison Janney, she's trying to decipher job offers, right? Everyone wants her for their board or for all these things. And then a very wealthy individual walks in and says, I just want to give you like $100 million or whatever the dollar amount is to fix a problem. I don't know what the problem is, but I believe you do.
That's what I want.
Yes. They made me think of that because, and she's debating all of these like fancy jobs, and then she's like, someone's willing to give me a lot of money to fix problems that no one's talking about. And because the first one she pops out with is roads. People need better roads in these like remote places. He's like, all right, go build roads. Yeah. So it made me think of like, there's just, how do we kind of get to that that point where some of these really cool ideas. And that's one thing I like about Unfunded List is I always say that I learn about new problems at the same time I learn about new solutions. Yeah. Because you can read through and be like, I didn't even know that was a problem.
Yeah. Oh yeah, that's really interesting.
But someone's trying to fix it. This may not be the most amazing proposal ever, but they've thought about, they're trying. Yeah. Let's help them, in the way I can, which is provide feedback.
Sure.
And maybe someone on the panel will read it. And we have a lot of funders on the panel, and they'll be like, you know what? This is really cool. Yeah. I want my group to fund this. Yeah. So maybe someday.
Totally. Oh gosh, I had
sorry.
Useful thought and it's gone, but
it happens.
Oh no, what I wanted to say is, I like the idea of somebody, saying here's this much money, but we don't have to wonder what people want. Obviously you can just go talk to them, but
that's true.
We can do that, but there's also a couple of books, again,
I love book
historical. So one of them is called Time to Listen. Okay. And it's hearing from people on the receiving end of international aid. It is fascinating. I only learned about it like 2 years ago, so I'm not saying everybody should have heard about it, but it's really interesting. And they talked to 6,000 people who had been involved across 40 countries, I think. And, at the beginning, they summarize it. It's like, so everybody said, thank you, but everybody had a but, and they had a diagnosis of what they would have liked better. And some of that is how they would like to be treated. Some of it is more specific, but that's a good starting point to get a sense of like, here's how people feel about it. All of this is supposed to be people, and we've turned it into projects because we want to be organized and we want to check boxes. But all of this is about people. Yes, people are complicated, and they all want different things, and so we're just going to give them the one thing that we know how to do.
Exactly.
Because I read a book or somebody stood on a stage and told me that was the thing. So that's a great one. And then as I was looking, I go down these rabbit holes on certain things, and there's another one that the World Bank put together called Voices of the Poor, and I think it was a three-part series. Same kind of thing. Amazing quote. On and on and on quotes. And I think they also had a huge sample size. I don't remember the exact number, but
I want to read that one too.
Those are great places to start. I think they're both free.
Yep. Excellent.
And they're, anyway, so that's a start. There's also Talk to Loop, which is a whole feedback thing that's more current. They put together summary reports. there's a lot of stuff out there. So we don't have to say, well, I don't know how to talk to a poor person in Kenya. You don't have to. You don't have to start with that. Start with this. Get curious. You know, I bet you anything there's an organization that is working with that person that you're thinking about already, who is Kenyan.
Oh, I love that. So those will be added to my reading list, which is already.
My book does have a reading list, and I'm putting together an expanded one that I'm going to chuck on my website, bullshitwithoutborders.org, because I keep hearing about books. Like that Peace Corps one I mentioned is Peasants Come Last. Somebody was just, I was telling her about my book, and she said, have you read this book? And I said, I have not, and I need to read that. So yeah, I almost need like Bullshit with Borders Part 2, Without Borders Part 2. But writing a book is hard. And so I'm probably just going to put stuff on my website.
No, so I have to ask one more question before we wrap up, because I love the title, and like the sections in it all have really catchy names. I have to ask, like, was there a thought behind using like provocative language in the title and in the chapter titles and all of that? Because you have like a drinking problem, or shipping city stuff, like say that 3 times fast. Like was it just because it was fun and you thought it would grab attention? Like, was there a thought behind that?
Sure, it's all very well thought out. All of it is. But this title actually comes from a workshop that I did before the course at Georgia Tech. And I was seeing these people with these contest ideas, and I was like, maybe they need to learn like, well, what could go wrong. And so I put together a weekend workshop with Shannon, the one I was talking about from Trupani, and it was aimed at students, and we wanted to make it fun and provocative and interesting. And we had a friend of mine calling from Malawi. We had these Adam Ruins Everything videos. He does great fun things. And we made it kind of fun and interesting. And so I wanted a provocative title. And of course, there's Engineers Without Borders on campuses, right? So they kind of know that lingo. And then the course, we couldn't call that because, it's a university, so we couldn't call it that. But that name has kind of stuck with me. And I wanted to be provocative. There are a million reports that are saying the same stuff I have. I refer to that. There's nothing new in here except maybe a couple of the stories, but I wanted something provocative, interesting, and I wanted to appeal to people who were open to, hey, maybe we're not getting this right.
Yeah. No, it makes for a very engaging read. I was like, it was fun, it was fast. I learned a lot by reading it. I have so many, again, there are so many things we could have talked about. But I also know that people have attention spans, and sorry guys, I don't want to keep you here for 3 hours. We'll just have to meet for cupcakes again and chat about that. So I thank you for joining me today. This has been really fun.
Oh, it's totally fun. Yeah.
I'm so glad. So first of all, folks, I will be able to get a link to your book on the podcast episode.
August 11th. August 11th. Yeah.
Yay. It's really good, guys. You should take a read and a listen at some point, because you're recording the audio.
Yes, and I'm going to do funny voices and everything.
I love that so much. So I do a lot of community theater, not on stage, usually backstage. My husband likes to do it on stage. But I do love when the audiobooks have they just try to mix it up, right? I read a lot of audiobooks, and when they make it a little fun, it's so much more engaging.
What do you think about, I have kind of a future robot voice for the Museum of the Great Aid Era because it's the audio guide transcripts. So I was going to try to do like, welcome to the Great Aid Era Museum.
Oh, I love
something like that.
Yeah. It's gonna be, oh my gosh, you guys totally get the audiobook. I can't wait to read it again when that comes out. Just to hear you use all the
Thank you.
So I know that one of the ideas that really stayed with me today, and when I was reading it, is that the challenge isn't that people don't care and they don't want to help, and that there aren't a multitude of problems and ways to fix them. But I think we can do things better.
Of course.
Right?
Yeah.
We can all do things better.
Yeah.
I mean,
and people are doing things better.
Right. So I think I don't want to leave us as a downer that things are wrong. There's lots of good going on. And I really like how you do highlight areas where it is not doing so great, but then every chapter has that
spark of hope. Yes.
There's hope, guys.
Yes, there it is.
And I think there's hope for all of us. Like, we're all just trying to do what we can, because we're also all human. Yes. And we make mistakes, and hopefully we learn from them. So
there's a great, I think it's Maya Angelou. She's like, as soon as you know better, do better.
Right. Yes. classic for all of us.
Yeah. A lot of us are just not aware. I wasn't.
No,
I didn't know all this stuff 30 years ago.
I mean, if you had asked me before I talked to you, I would have said, yeah, there's probably some issues with, water projects. I would not have been able to share what those were,
Yeah.
or like in that sort of detail, or really know like the extent of them, right?
Yeah.
Like maybe one or two didn't work out, but I would not have known maybe the extent and maybe some solutions to help it, because you see these.
My problem is that it's the same things over decades. And I want people new to this, or young at heart is the way I say it, to skip steps.
Yes.
What you don't have to learn your own self how to make mistakes. At least the same mistakes. Make new mistakes.
Make new mistakes.
Yeah.
That's my thing with a lot of things. Just make new mistakes. You can make mistakes, but make new ones, because we've already made a lot of them. So
and then acknowledge it. Take accountability for it. Fix it. Like, we have not gone back and we fixed other people's problems. We haven't fixed our own. Anyway, there are sparks of hope.
Yeah.
The whole last chapter is about trying to look forward. Yeah. And I still haven't figured it out. This book was almost like therapy for me. It's like, what was my role in this, and what should I have done, and what could I learn better?
Well, again, I think we're all just trying to kind of figure that out. And reading this and using some of the tools at the end can be a first step for some folks who want to get involved in water and sanitation issues.
Sure.
But I think there's some really good questions in it, and I'm excited for people to read them and take away from it, things we can do better, things we're already doing better.
Yeah.
And just, I think it's a really fun read. So if you would like to learn more, we'll have it on the podcast link, and we'll have a link to the website as well. It's very exciting. Any other final thoughts before we wrap up today?
Oh gosh, just thank you for this. And let's change the way we change the world.
I love it. Well, I'm not sure I could end on anything better. Thank you for joining Open Door Philanthropy, especially Open Door Philanthropy with Margaret, not Dave. And
special episode.
So this was super fun. And again, thank you. I can't wait for everyone to hear all about bullshit without borders, which I needed to say one more time because I normally don't use curse words. So
bullshit without borders.
So awesome. Thank you.
Oh my gosh, so fun.